Now we're going to shift to a very special portion of today's event. We'll hear directly from patients who have experienced taking sirolimus. They'll share what it's been like for them, and then afterwards we'll open it up for your questions to them. So as before, feel free as we're going through this to ask questions through that Q&A icon at any time. I'll read them aloud after the patients say a few things, and we'll go from there. So I'm truly honored to introduce you to Jill, Tim, and Trista. And you can now reveal your video if you like, Tim, if you're ready. Thank you. So Jill and Trista are both currently enrolled in the study, and they'll talk a little bit more about their experience taking the medication as well as their experience with MD Anderson, so they can speak to those topics. Tim, as you might know, is one of our founders, and so he is in London now, and so he's taking the medication from afar and contributing his experiences and data from there. And then as a founder of the Runstone Research Program, he's of course a key reason why this whole trial is possible. So thank you to the three of you ahead. You're true heroes in this effort. Your courage, honesty, and willingness to participate in this study and then share your experiences today are really helping drive research forward and bring a lot of hope to the families that I speak with all the time. So thank you for that. And I will let perhaps Trista get started as our first sirolimus trial patient.
Sounds good. Thank you, Amanda. So thank you everyone for joining. So yeah, my name is Trista, and I completed the 6 months trial. So I started in July, kind of when the trial first started. I was the first participant, and then I took my last dose, I guess a couple months ago. So I'm completely done. So please, I'll answer any questions. I'll be very, very honest about everything. And to directly answer one of the questions before, I was one that I felt great before the trial. So just the reason I took it is I do have RUNX1. My sister and my mom both have leukemia, and it turned out later that they also had RUNX1. And then my younger son was also diagnosed with it. So kind of with that family history, my sister's in remission, my mom didn't make it. So when I saw the trial and I thought, hey, there's something I can do, I feel great. I'm 48. So, it's like, I feel healthy. I haven't had any major medical problems. I wasn't on any medication. So I thought if I can somehow just do this and see how it works and hopefully help out anybody that needs it, or myself maybe even later. But that was kind of my determining factor. I will say that I'm local. I live in Houston, so I didn't have a lot of the barriers that others have of getting to MD Anderson. So I am a teacher, so since it started in July, I was still on my summer break. So I had kind of the best of all worlds right there. So I'm local and I was on summer break. So I got to do a lot of the pre-trial screening and stuff. It is intense. So if you're thinking about doing it, definitely staying that week would be great. I was up at MD Anderson a lot. But again, having my mom and sister, it was like our second home. So we've had birthdays and everything else at MD Anderson. So it was just like, all right. So I did a lot of my teaching prep there, and it just kind of became a day. So I just stayed up there and we did all the prep, but definitely staying local. If thanks to Amanda and the RUNX1, that's a really great option to be able to stay. After that, when I started taking the medication, really the level of care by Dr. DiNardo and Jill, the nurse, Jillian, was amazing. So it was like check-ins, how are you feeling? The first week that I started the medication, I had a lot of the symptoms listed. So I had my stomach ache, I had headaches, I had joint pain in my wrist. If I went outside, I would get like overheated. And so the first, I guess like 2 weeks, there was some adjustments. But then after that, it all pretty much went away. I will say I had the nausea and stomach aches persisted the entire time. So, but it was manageable. I never had to stop. I never felt like I needed to stop. I'm the one that lost the weight. So I lost like 35 pounds, which is amazing. And some of it was after the nausea, it was always very low level. And as long as I managed it, like I took the pill in the morning and then I waited a little bit before I ate breakfast. And that was really, I never had to be on any other type of medication. It was always offered. But it was I just kind of adjusted sort of the way I ate. And then after a bit, even that kind of went away, and it just became where I wasn't really that hungry. So that's kind of how it presented. So the whole 6 months, I really wasn't that hungry. I didn't eat as much, which was probably the weight loss. So that part was, that part was great. I will say that I have, I played soccer and I run now, and I had some chronic knee pain, and that actually lessened with the sirolimus. So I don't know if that's now that I'm off of it. I chose not to continue because I wanted to see how it felt when I was off of it, and the knee pain hasn't returned. So I don't know. I don't know if it was sirolimus or, I did stop when I felt so bad those couple of weeks that I don't know if just resting it helped. I don't know what the rationale is behind that, but I will say that if there was ever a longer trial, I wouldn't hesitate to be on it. So the symptoms weren't ever bad enough, especially once I got on the medication, and my body kind of got used to it. I tolerating it, I felt great the whole time. I never really felt bad. I couldn't really tell I was on it, except for just the hunger wasn't really there. About halfway through, I want to say about 3 months through, I started having GERD. And that was the only kind of bobble in the whole thing. Came out of nowhere. It was like one night I just thought, oh man, like my stomach really, really hurt. And it was so, but again, I messaged Jill and she suggested an antacid, and I started taking that along with the medication, and that took care of it. I continued that for the rest of the time. I didn't want to stop it because it was a couple of weeks of, it was really painful. So, I mean, a couple of days, excuse me, of it being pretty painful. But then once I started the antacid, that took care of it. And just that little simple thing. And Jill was right on it. We had talked about possibly lowering the dose for a little bit, but I didn't need it. So once I took that, it pretty much took care of it. So yeah, it was 6 months, and now that I'm off of it, I can't really tell a difference, so I felt great the whole time. I had energy. The only thing was that low level kind of nausea, which kind of morphed into just not being hungry. And then I will say in Houston, it gets really hot. And so I did notice, I was a little more sensitive to the heat. So, but it's also Houston and really hot. So yeah, it wasn't a big game changer in any way. I would absolutely do it again. And Amanda spoke some about our biggest surprise was that how little the insurance cover. Well, I guess it did cover a lot, but insurance, I had higher bills than I was expecting with the process. But I reached out. The Runks One team again has been amazing, and just you feel well taken care of during the study. So they're kind of working through helping me cover it, and then also MD Anderson. I'm on a payment plan, and I was already on a payment plan because I already go to MD Anderson, so I was already a patient. And so, but that part, Runks One has been really great. The foundation has been really great with kind of helping figure out the payment process of it. So, I guess that's it. If there's any questions, I'll answer any questions. And like I said, I'll be very honest. So if you have any specific questions, let me know.
Great. Thank you, Trista. That's really helpful. I'll be watching the questions and I'll bring them to the end.
Okay.
So we can shift to Jill. Do you have anything to add about your experience or anything that was different with MD Anderson?
Yeah, I mean, I guess just to go back to the original question of why I did this, it's very similar to Trista. My mom has had Runks One. Unfortunately, she passed away in November with AML and had MDS as well. And so I just wanted to do something that could help. And my son also has it, and I'm hoping that in his future he'll have something that really prevents it. So being a part of something like this, I think, is really important for me. I was also very healthy. Well, I thought I was very healthy. It turns out that some of the things that happened to me in life are because of Runks One, and I had no idea. So that's been, I'd say, a positive for me taking Sirolimus. I'm about a little over 3 months into the trial. I had tons of joint pain all the time. Just if the weather was changing, if it weirdly went with the barometric pressure, and I would just feel like I was getting the flu, but I never got the flu. But it happened constantly. This happened to my mom all the time too. And since taking Sirolimus, I've had none of that, zero. So no joint pain, no flu like symptoms. It's amazing. So that for me alone has been really awesome. I also have kind of seasonal allergies and would have to take in the spring and fall because I had mold allergies and then pollen allergies, and I would have to take some sort of allergy pill every day, and I haven't taken one since I've been on this. So that's been pretty awesome. Um, the team at MD Anderson has been phenomenal. They treat you so well. I like that place is, I live just north of San Francisco, and so I have my normal care at UCSF in San Francisco. And while they're great as well, I will say the MD Anderson team, they are like dialed. They're amazing. I mean, you walk in, just when you walk in the front door, like they're like, where are you going? Let me help you get there, blah, blah, blah. And it's just a very, very good experience. And Jillian, the nurse who's kind of helping with everything, I feel like she's kind of my best friend now. I talk to her, I think, more than most of my friends. And we talk about tons of other stuff too, but she's just really, really supportive and always there for you, which is really awesome. I have had some similar side effects in the beginning. I had headaches and nausea, which kind of went away after probably about 2 weeks. So similar to Trista. And I had a couple other side effects happen. I had mouth sores. It could have been because I was the one who got the UTI, my first ever in my life. So it was definitely related, I think, to the sirolimus, since I've never had one before. And the mouth sores could have come from the antibiotic I was taking, because it happened right after taking the antibiotic for the UTI. So it's hard to tell, but I did have mouth sores. I mean, I did like a mouth sore, mouth rinse, and they were gone in a couple days. So none of the side effects have been like, oh my gosh, I want to reduce it or get off of it. I actually think it's been fine. And the not having those flu-like symptoms and not having allergies has actually improved my daily life, that these like other little side effects don't even register with me. So yeah, I think that's for me. I'm happy to answer any questions as well. I still have another few months to go, but so far it's been a great experience, and I would actually like to stay on it if I could, especially if they see good results with the bone marrow biopsy at the end.
Great. Thank you, Jill. That's really encouraging. Glad to hear it that you're feeling so well. All right, Tim, now last but not least, what would you like to add about your experience?
Oh, well, thank you everybody for joining here. I've been taking it for 18 months now in London, sort of privately. I'm very happy that I'm on it. I don't really have any positive or truly negative side effects. Unfortunately, I haven't lost any weight. That would have been good, but um, not hasn't happened. I do have bad hay fever in London, and it's not gone to the level where I don't have to take antihistamines, but it certainly has gone down the level of hay fever that I have. So I take antihistamines a lot less on here. My wife says that I bruise less. I haven't really noticed it, but she thinks over the last 18 months I've bruised less. It's not necessarily a scientific viewpoint, but it's just sort of an objective viewpoint on here. And I intend to take the dose forever, just privately through my physician over here in London. Um, and Obviously, I would participate in the MD Anderson study if I was in the U.S. at this point in time, but it's just not feasible to get back to the U.S. For the schedule. And I guess the last thing I'd say is the reason I decided to go on this is because I am 48, and a lot of members of my family contracted AML in their 50s. And so, I'm concerned about myself progressing to AML. And in looking at sort of the data on um, on sirolimus, like there were positive preclinical studies, and there's positive things that could happen. And then this has been a drug that's been around in other forms for decades, and there's not really any negative aspects to it in how it's been used. So it just seemed like there's potential upside and there's very little downside. And quite frankly, I forget that now. I forget that I take it. Like I take it with my vitamins every morning, and it just I if if somebody had to remind me. Otherwise, I wouldn't even think that I was on it these days. So that's all I have.
Yeah, that's great. I'm glad it's feeling so well for you, Tim, as well. That's really, really nice. Okay, I just realized I just put in the reminder to ask questions, so feel free, everyone. So thank you three for being so open and honest. And I know it's not always easy to talk about the challenging side effects or such personal topics, but it sounds like things are really just generally good in your experiences. I guess a question I would have for you is, would you, as someone seeking through it, it sounds like all of you have been affected by a family member becoming ill. So you would recommend it to anyone sort of debating, I'm feeling well, I'm not gonna, I don't want to touch my system. Would that be something that you would recommend trying?
I mean,
Um,
yeah, from my perspective, yes. I mean, as you know, I also did the stem cell harvesting and banking
Yeah.
clinical trial. So I'm kind of jumping on anything where I see that there could be a future benefit for me, my son, and others. So yeah, for me, that's a definite yes.
So, and kind of to piggyback off that, my son is 19. And so he just recently got his driver's license and got a car. So he's now mobile. Whereas before he wasn't. So I'm trying to talk him into doing the trial. He lives in Houston also. He's in school, but I'm somewhat overprotective. So I was like, let me do it first and let me see how it feels before, but I would absolutely. So I'm trying to get him involved. And it's really more just trying to get a 19-year-old into a clinical trial around school and everything else. So, but yeah, no, I would have no hesitations on getting it. And he's a 19-year-old fit athletic guy. So, feels fine. So, I think any of the side effects that I did have, it kind of went away, kind of like everybody else's. I mean, like for me, the nausea was always there, but it really kind of like Tim said, you didn't really even notice it. Like it just kind of became, especially over 6 months, like I just wasn't as hungry. In the morning, my stomach is kind of nauseous, but it wasn't anything I never thought about stopping, or I never thought, oh, this isn't worth it at all. So there was never any side effects that I thought, man, I felt so good before this and now I feel really bad during. So it definitely wasn't like that. It wasn't like, oh, I can't wait for the 6 months to be over to stop. It was like, no, when it was over, and Dr. DiNardo did give me the option to keep going and continue it, but I was just curious to see what it would feel like when I was off it. So, and there hasn't been any difference really for me. I wasn't like Jill, like I didn't have the joint pain and stuff like she has. And so I was just curious, like, would the knee pain come back? Would I feel different when I got off of it? And I haven't. So if they do offer a longer study, or Dr. Donato and I even talked about maybe being on it long term. So that's something that I'm considering, because for me, there was nothing while being on it, as a healthy person going into it, that would be like, oh no, don't do this. So especially after those, be prepared. You have 2 weeks of kind of feeling as your body adjusts. So there was that 2 weeks, but 2 weeks in the term of 6 months. And if there's potential benefits, to me, it was totally worth it.
Tim, I think you were kind of,
lastly, I was gonna say,
Yeah.
I would echo all of that. I think that it's a pretty easy decision to go on something with sort of minimal side effects, and that's been well studied for a period of time and has, potential upside.
Okay, great. Thank you. Trista, you got to kind of where I wanted to go, but then I didn't want to be intrusive about if you'd recommend it to your family members. I know that's very personal. So thank you for touching on that. But totally get it. 19-year-olds are hard to pin down. I know a few of them. But yeah, if you'd like to connect them to us, feel free, at any point. So is there anything you would have liked to have known before you started the trial? I guess that'd be more Trista, Jill, ahead of time, thinking back. Is there anything you wish you had known?
I mean, I think Trista touched on it. I think the financial part has been like US healthcare in general. It's one of the only things that you like sign up for and you're like, well, I could pay this much, or it could be this much. We're not sure though. You go get it done and then we'll give you what the bill is. It's kind of like, would you ever buy a car if they're like, it could cost $100, could cost $100,000. But once you lock in, then we'll tell you. So it's that I think is, I mean, it's obviously not Dr. DiNardo's fault. It's not, it's just the way our healthcare system works, which is unfortunate. But I wish there was a way, especially now that AI is so prevalent and everything, it would be so easy to be able to like run a simulation of like, this is me as a patient, this is everything you have to do for this trial. Like, this is my insurance. It should be able to figure out what the cost is pretty closely.
Yeah.
Just don't think they want to do that. So I'd say that was probably the biggest surprise because I sat down with the financial planner at MD Anderson and they gave me this like very astronomical number. And I was like, they're like, but we don't know what it'll be after your insurance. So you'll just have to figure that out later. So that's really the only piece.
Yeah, that's so frustrating. Yeah, yes, I couldn't. Yeah, we are trying to, with this discussion I mentioned during Dr. Donato's part, we've been talking about how to, help cover most of the costs that come out of pocket. And we will set into, some sort of best practices. We will make guides for patients ahead of time to how to sort of talk to the team, how to think about this, how to talk to your insurance company. And thank you to Jill and Trista, because I'm learning from you a lot, because you've sat with me, we've called MD Anderson, trying to understand what we could figure out if we went back in time. So definitely learning a lot from you so that we can help patients moving forward. But yeah, I think Jill, right, we're learning that there are just so many limitations to the healthcare system. So we'll do our best to address that.
I will say, for anyone considering it, yeah, Amanda has been amazing, and Katrine at partnering with me and working on this. So yeah, I don't feel like I'm just left out in the cold at all.
It's a lot to navigate. So anyway, glad to. Thanks, Jill. Anyone else want to comment on that?
Yeah, no, and just to echo, I still think even with the balance, and even though it was more than I thought, I would still do it again. So it wasn't, to me, you have to weigh both. At the end, you're talking about weighing the pros and cons, and financials does come into it. And we have 3 kids in school, and I'm a teacher, so it's not like the financial part was a consideration, but it would still be something that I would do again. And you guys have been amazing in helping us kind of navigate that. So yeah, you do have to weigh it in and talk to your insurance first and talk to MD Anderson. I just jumped in and was like, okay, great. And so I wish I could have gotten a bigger scope of what it would have been, but we're on a payment plan, and if and we're talking to you guys who have been very helpful. So it's definitely manageable, even if it is a little more than you thought. There's ways to just kind of pay it out. And I think for me, the knowledge of, now that I'm not doing it, I loved getting like those tests every month. It really brought like a piece of knowing what was going on. And so, when you have RUNX1, especially coming off, so many of my family members have had AML, like to see that, to get that knowledge, to get the bone marrow, that was very comforting within that 6 months, to know exactly where I'm at, to know what's going on. So that part it did bring down like general anxiety, because before that, you get the bone marrow once a year, and you get like your blood tested every once in a while, but having those monthly visits, that was a really big benefit that I don't know. It's just, I didn't know that I was missing, but it was nice to see my blood counts every month, and to see them stable, and to see, and it was very stable the whole time. So, that portion of it, even though we were paying for it, was a big comfort just to see it. So.
Oh, good, Trista. That's great. Okay. So that was the big surprise on the financial. Just want to reiterate, if anyone on the call is interested, please reach out to me, because we are in final stages of sort of working out all the details, and we want to help. So we're glad to do that. So maybe for you, Tim, you said you've been taking it for about 18 months. Do you know when you started to really feel different on Sirolimus?
Yeah. I don't know if I've ever felt different on it. Like, I didn't really have the nausea. I didn't really have anything, that changed. It just feels like I'm taking a multivitamin.
Okay.
It's just another pill. And it's like, I don't feel any positive or negative, except that like when spring came around, like my hay fever symptoms were less so. So like for the 18 months, there hasn't really been any difference.
Yeah. Okay. Okay, good. Yes. So it's just situational when you maybe would have had allergies. They're not there. That's great.
Yeah.
Have you been back to Santa Barbara? Because I know Santa Barbara, did you have allergies in Santa Barbara? I can't remember.
My
You have
allergies are
places, right?
my allergies are worse in London than they are.
Oh, okay.
Yeah, yeah, no, Santa Barbara, I guess, just more of a temperate climate, but London, it's sort of like damp and wet. And so like everything's sort of in perpetual bloom all spring and summer. So it's actually worse here than it is in on the East Coast or West Coast, believe it or not.
Okay. So good. Okay. And you're not feeling those allergies.
No,
Okay,
no,
great.
not as much.
Yeah. I guess I'm thinking Jill and Trista, you kind of talked on about when you sort of started feeling different things. And I think it was pretty quick, right? Okay. Would you, what would you tell, doctors and researchers, what would you like them to know about, sort of the patient perspective around participating in a trial or putting your neck out there and trying something like this? Is there anything you would share back to, doctors or researchers, if not patients, because I feel like we've touched on that.
I feel that MD Anderson and Jill and Dr. DiNardo did everything right. Like, to say what Jill was saying, you felt taken care of. They were so frequently checking on you, checking for symptoms. The days at the hospital, if it took too long, Jillian was messaging me, let me get on that. You shouldn't have to wait. Like they were really working around. I took off, again, I'm very lucky to live in town. And so I would just take the day off work, and a teacher, and my school was super supportive. So we got subs and they got someone in. So I took the day off, but they made sure that I wasn't there all day. And they were like, oh, let us get you in. So if there was ever any symptom that did come up, like when I had the GERD, it was so I didn't even know for sure that it was the sirolimus that did that. But all of a sudden I just had pain, and it was like, I messaged Jill, like in the morning. It's like, oh, I have this pain that's new and different, and it hurts. Like it was very uncomfortable. And I'm a special education teacher, so it was like I still had to work with kids all day with this pain. And I mean, by the end of the day, it was like, let's do this, let's do this. It wasn't even, so on a patient end, they were amazing. It was very frequent check-ins. When we had clinicals, if I had to ever switch anything to get a sub, they were very easy to switch. You do have a window that you have to do it in, but they definitely work within your schedule to be able to get it. So, and there were times like if we had testing, or if we had, different things, like, oh, I need to move it to a Tuesday instead of a Thursday. And they're like, yeah, no problem. So it was just really easy. And they definitely, you never felt like you are not being checked in or cared for or something. So as far as from that end, and you guys too, Amanda, so you guys too, it was all like, it's so caring and so supportive. I have absolutely no suggestions or anything, but except keep doing whatever was done, because it was an amazing experience.
Thank you.
I agree. I wish that doesn't really relate to a clinical trial, but I wish that this was what patient care was like in general. I think that we're treated a bit special because we're part of a trial. But I wish that, when my mom was going through AML and MDS, and I wish she had the same sort of like, could text somebody and be like, I'm having this, what, can you help? So it has been amazing. I wish all patient care was like this.
Yeah, me too. Okay. Well, I apologize. I just realized we're 4 minutes over, so I don't want to keep you all any longer. Tim, do you have any last thoughts you want to offer before I say thank you and let you all go? Okay.
I don't have anything, but if anybody's considering doing this and wants to speak to me directly, email me, or Amanda, can connect you via email if you don't have it, because I'm very positive about my experience and how this will help others. And so I want to be able to share that with anybody, one-on-one if they need.
Great. Thank you. Appreciate that. Yeah. Reach out to me. I will chat I think everyone has my email address, but I'll put it in the chat as well. But please reach out to me if you have anything else. And a heartfelt thank you to all three of you, Trista, Jill, and Tim, for not only your time today, but your willingness to be vulnerable and participate in this trial and put your neck out as the first ones taking this new medication for our community. And your voices are really, really powerful today. Thank you. I learned a lot. I talk to you all the time, and I learned a lot about your experience today. So thank you for that. And on behalf of the whole patient community, we really appreciate what you're doing. And All right, thanks. And I'm
Thank you,
really
Amanda.
it's great to see you all. Take good care. Okay. Have a good weekend. It's Friday.
Thanks. Amanda. Bye-bye.
Okay. Bye. Thanks.